to ask you one question. Have to ask you, and I think the listeners would love to hear this and learn this about you.
You can pour yourself into other people. It's not as much of a job.
You're gonna leave just knowing so much more information to at least to better make a decision or to better manage it, at least partly on your own.
You and I have talked about some of the really cool modalities you do, and it's like, hey, that's awesome. Like, let's dive into that because again, it helps patient outcome.
Hey guys, my name's Ken Clark, owner of Purpose Physical Therapy and the host of the St. Petersburg Professional Spotlight Series. And with us today for our very first show, our first guest is someone that I deeply respect. And I know you guys will learn so much from. Dr. Zach Barnett is a board certified podiatric physician who specializes in advanced foot and ankle reconstruction, 3D gait analysis, sports-related orthopedic pathologies, and anything really related to the foot and the ankle. He's originally from Texas. He's a husband, a father of four, and a business owner, a patient-focused business owner seeking to restore the patient-doctor relationship through empathy and innovation. Dr. Barnett, thanks so much for joining the show and welcome.
Thanks a lot. Glad to be here.
Yeah, you're welcome. I'm glad to have you. And before we kind of dive into the conversation and just learn a little bit about your story and your why, I have to ask you one question. And I think the listeners would love to hear this and learn this about you. A lot of your patients and even some of mine now that we share have come to know you as Boots or Dr. Boots. So tell me a little bit about what that means and how that came up.
Well, it's funny because I feel like I'm a Floridian now and I'll be here forever. I love Florida so much, but I was a sixth generation Texan. So, Texas has a lot of pride. Grew up in West Texas, which is real Texas. It's not a city, and it was real. We owned a ranch and had a farm and that kind of thing that I would go visit with my grandfather, each day, whatnot. And so just got big into wearing cowboy boots, and I fell out of it a little bit, but went to med school and then residency, and I was back into kind of wearing cowboy boots, and it kind of stuck. A couple of the docs would look at me funny and say, that doesn't even match. Like, that's like wearing dress shoes with pajamas. Like, how can you wear scrubs with boots? And, in Texas, it's commonplace. Every hospital, everyone's wearing them. But outside of Texas, it was like almost like something that kind of stuck just because it's something I'm in all the time. So,
they say you could take the man out of Texas, but can't take the Texas out of the man.
True. So
love that. That's awesome. So let's get a little bit into your story. Tell me, like, what drew you to this specialty? Was there like a personal moment or a mentor that influenced you on this path?
Well, I've always just kind of had a deep level of empathy for people. I thought I would be a vet at one point. And then, in my college, it's something in the human sciences just because I did a little research after college in neuroscience because I thought, studying small cell lung cancer was really intriguing. And I actually did a Susan G. Komen 3-day walk right when I had finished college, and I was just volunteering in the medical tent. Actually, it was a bunch of physical therapists working it, and they just, as a college student, I didn't really have a lot of experience, so they just put me on blisters because it was a 3-day walk, and so a lot of the people there would get, new shoes before they did this, and they would get blisters, and they just said, "Hey, let me show you how to lance a blister, pop it, put a Band-Aid on," and I just did it without thinking, and so they all kind of came up to me and were like, "You should be a foot doctor. That doesn't gross you out." And I'm like, it really doesn't bother me. So shadowed some doctors. And really, I think the thing that intrigued me, I had worked with a foot and ankle orthopedic, and he was really brilliant. And he had multiple fellowship trainings, and really he resided on the foot. And he just said, it's kind of an unknown territory. You don't learn anything about it really in school. And so many specialties just don't know a lot about it that, he said, save yourself a lot of time. Go kind of the podiatry route because you can do the exact same things I do, and save yourself 5 years. So really our training was, though I did kind of everything in orthopedics and neuroscience, and I did a lot of plastic surgery, obviously it's still with kind of a focus on kind of foot and ankle pathology. So, did over 2,000 surgeries in residency. But, all of it kind of geared towards that mechanic involved and the kind of the engineering side. And so the foot really has a lot of engineering involved. So that's kind of what got me into podiatry.
Yeah, yeah, absolutely. I know you mentioned in the beginning, always had a lot of empathy for people. Is there moments or a moment where you realize that there's meaning for you in this beyond just like the biomedical side of it?
Absolutely. I mean, I'm a man of deep faith. So my faith
Yeah.
is the number one thing for me to begin with. So
Mhm.
I could not do this job. And I feel like I just have a level of joy that's a lot deeper. And so I think when you look at that and you can pour yourself into other people, it's just not as much of a job. It's like, hey, you see someone hurting and you really just, I have a skill set that's unique. And so I
Yeah,
think I'm blessed to be able to say, hey, like, I may know a lot about this area, but at the same time, still, it's like it doesn't feel like work to me when you,
yeah,
are doing something that you really feel called to do.
yeah, yeah. And you can make such a big difference because I mean, you're literally the hands and feet, and you are making an impact on people's lives. They have to move around, so
Right.
um, yeah, I love that. That's amazing. I can resonate with that as a man of faith as well too. So one of the same reasons that I decided to go into physical therapy. So
And
uh,
it makes a difference because it's like, you're patient focused. I really
mhm,
feel like I want the relationship with the patient. I want to get to know them. I want to spend
sure,
time with them. It's not kind of a numbers game, and it's not,
right,
I practiced in a couple of other jobs that it was like you're kind of a technician, that the person doesn't even if you did their surgery, they remember the company, they don't remember you.
right, just
It
yep,
just seemed shocking to me. It's like, how did you just have that big surgery? Oh, it's because I never really saw you. It was kind of
mhm,
like, my job is done, punch you off to other people that'll manage the
right,
care. Where it's like, I want to be there from start to finish. Like, I'm not here to just do a surgery. I'm not here to just
yeah,
do something even simple. I'm here to see it out. And that's
yeah.
why, it really kind of motivated me to do what I do.
Start your own practice.
Right.
Yeah, yeah, yeah. So that's awesome. Is there a patient success story that comes to mind that kind of just reinforced you what you do?
Some of it was in my old practices. They were like, we love you. We love what you can do for us. And like, you
Mhm.
spend the time with us, but like, I can never get in touch with you. It's like the office doesn't translate the messages, or, when you're on call, it's someone else doing it. And I just didn't feel like, though I don't want to be like a control freak, I never felt like I had all the pieces to the puzzle.
Mhm.
But really, I think some of the success that I had was really hindered at other practices, because it was like, you need to send to this particular person that's part of the business. These multi-specialty groups that are owned. I'm like, hey, I want to vet every person I use because they're a reflection of me. And frankly, I think the success stories that are the best for me half
Mhm.
the time don't even directly involve me. If anything, like when it comes to the foot, I may be kind of the head coach and say, okay, you have a tendon problem, you have a nerve
Sure.
problem, you have a circulation problem, and I'm going to directly connect you with the people that are even maybe better at the circulation than I am. But I'm going to help
Yeah.
kind of advocate for you. And so, like when I've sent people to you, and like, to me, it's not like, oh, I may have only got to see them two extra times because you got them better. I think for me, it's all outcome based. So even if I send them to you, and I think that is a path that they will get better, and they come back 3 months later and say, hey, I'm better. I mean, that to me is successful. And I just wasn't able to do that because I just
Yeah.
didn't have the ability to make my own decisions. It was kind of like,
Mhm.
you see the clinic patient, this is kind of outlined the way you're going to do it. So I just love meeting new people. I love doing
Yeah.
more innovative things. You and I have talked about some of the really cool
Sure.
modalities you do. And it's like, hey, that's
Yeah.
awesome. Like, let's dive into that because, again, it
Mhm.
helps patient outcomes.
Yeah, absolutely, absolutely. And so on that topic, and you touched on a little bit, but beyond clinical outcomes, how would you, in your view, define what exceptional care looks like?
I do. I think it's like that, the relationship component.
Yeah,
One
yeah.
of the most touching things that happened today,
Hmm.
a patient that I haven't seen in probably 4 months had some major kind of circulation issues that we connected him. But really, we didn't do a ton with him. It was more kind of guide him through the process of getting the circulation improved.
Hmm.
And he happened to jot down Jenna, our medical assistant's birthday. So his 4 month follow up, he brought her a bunch of flowers. And it
Mm,
was really touching to her. And it was like, wow, we haven't even seen you in a long time. And he said, y'all have made such an impression on me. I remember her saying when her birthday was. And I mean, he made his appointment to be on the day of her birthday just so he could bring her flowers, like
that's
that. It's
awesome.
just,
Yeah.
that's kind of touching because, again, that goes well beyond like what did we do directly for him from a medical side, because I don't
Sure.
think I did really any procedure on him.
Right.
But at the
Right.
same time, it's like I need to make sure my appointment falls on your, your staff's birthday because they made such an impact on me.
Yeah, that's amazing. And that's also, that's a testament to what you guys do and do on a daily basis. And I've seen that for myself. Um, so I love that.
Oh.
So being a podiatrist, you have your clinic and the lab and all the things that you mentioned. What kinds of conditions do you frequently treat, or cases do you see most often in there?
I mean, honestly, I think my mindset has changed a little. Like when I first got
Sure.
out of school, it was entirely surgical. I felt
Mhm.
like, it was go somewhere else. And the practice I was with, go somewhere else until you need like the most advanced surgery. And I've got you on that.
Right.
And I kind of, to some extent, you're kind of trained to say, well, if you've got this advanced training, don't worry about the small things. Even some of the sports injuries that, an ankle sprain, give them a boot and say, walk it off in 6 weeks. And I just
Yeah.
started noticing in those clinics, people that would spend money on copays and deductibles and all that. And, for a problem that may have seemed minor, it might have been an ingrown toenail, or it might have been a little, joint inflammation or something on the skin. And so I started to really appreciate the value um, of just kind of overall care for people. So
Sure.
I definitely don't want to. I mean, I'm already kind of focused on foot and ankle in general. I think whatever
Yeah.
I do, I want to put a full focus on. Some of the simple things that I do, from like ingrown toenails and things like that, are
Yeah.
are simple. Some of the more advanced things. I mean, I think some of the things that are pretty easy diagnoses, like plantar fasciitis, ankle
Yeah. Yeah.
sprains, they're often kind of mismanaged. That there are a million treatments out there, and so I think, helping patients guide through that process, as like plantar fasciitis. So it's probably one of the easiest diagnoses. It's a
Sure.
Googleable term. Can be one of the most challenging things, and it kind of makes people question what's possibly going on, because how on earth is this still not better with
Yeah. Yeah.
the basics? And so I
Yeah.
think sports injuries are probably the thing that interests me the most, just
Hmm.
because I like to get someone back to a level that they can return to. So whether it be golf, tennis, pickleball, or even pro athletes,
Yeah.
it's really, and that's where the fine detail comes in. Like sports is what I refer my reference to everything. Even if it's a diabetic, it's like you look at what athletes do, and they get kind of the kitchen sink thrown at them.
Sure.
Not
Sure.
that they might not get over an ankle sprain in 6 months, but they might be able to get over it in 4 weeks. I mean, Tua, the
Right.
Alabama quarterback, had a high grade ankle sprain, and they actually did surgery on him. But his
Hmm.
rehab protocol was like 6 hours a day. And he
Yeah.
played in a championship game 11 days after a surgery. Like, though not everyone needs surgery, I thought that was an amazing rehab protocol
Hmm.
that
Hmm.
that doctor put together with the physical therapist to say, hey, this surgery that would normally be non-weight bearing for 4 weeks, he's going to be at game speed 11 days later. Like, that's kind of my motivation for a lot of sports injuries that I see, whether it be ankle sprains.
Yeah.
There
Yeah.
really is no simple ankle sprain. Ankle sprains, if they're not treated properly, really can linger for months and months and months. So I think those are some of the more common things, from you know conservative sports injuries to even more of the surgical stuff.
Yeah. Absolutely. Are those the types of patients, with the ankle sprains and plantar fasciitis that tend to, and the sports ones too, that tend to thrive the most, the way you approach your care and in your clinic?
Yeah, I think people that really like have a motivation to kind of go
Yeah.
back to where they were.
Hmm.
I
Sure.
think
Sure.
there are some people that they get the misconception of, oh, it's my age, whether they're older or even older athletes, like
Yep.
someone in their 20s, and they may not recover as quickly as when they were 16. And so
Yeah.
they just chuck it off to age. I think it's always kind of rewiring their brain to say,
Mhm.
you may in fact be able to get back fully to where you were. If not, you'll at least be able to do what you were doing before.
Yeah. Yeah. Absolutely. And just for not just athletes, but even just like the general population, I know you see a broad spectrum of patients, but what are the, I guess, for lack of a better term, early warning signs, or something maybe that they wouldn't think about, that they shouldn't ignore, that should prompt a visit to see someone like you, a podiatrist?
Well, I want people to know, like, reassuring someone like myself. It's like, they're not coming in, going, getting, the terrible news. Like, again, it's all about options. So to me, it's lay out an in-depth diagnosis,
Yep.
potentially why it happened, at minimum, what happened and what is going on. And then, lay out, everything. I mean, I just saw a guy with a full tendon rupture, and he actually has an option other than surgery. Now, he opted for surgery, but he knew both pros and cons of if he didn't get it,
Yeah.
so that he could make a very educated decision. But a lot of early warning signs can be like, and this is kind of goes with a lot of things. Something that may naturally heal on its own with maybe rest, ice, things like that.
Yeah.
Within 2 weeks, probably nothing to be concerned about.
Sure.
You can get bone bruising, tendonitis, and if those things are just a little overuse, and you just do the kind of simple things like compress and elevate and just maybe stop the activity you're doing for that 2 week mark, even if you're not an athlete, even if you're just walking and your foot hurts, you take an ibuprofen or something. Usually, if it goes away within a couple of weeks, probably nothing to worry about. More than that,
Right.
even though it may not be debilitating, something like plantar fasciitis, in particular, like heel pain, the longer you go without actually honing in on a treatment, the harder it is to get rid of.
Exactly. Yeah, that's what I tell my patients all the time. So the quicker you can get in to see somebody, the more you're going to stay on top of it, and the better off you're going to be.
There's like a fear, whether it be from doctors or, the therapists. It's like, oh man, it's like they're afraid of the answer they might get. So then they try and self-treat. And honestly, if you go to someone that really does have that level of empathy, it's like, if anything, you get fully educated, you get some reassurance that what you have will likely not progress, and then get you some tools that can actually move you in the right direction.
Yeah, definitely. 100%. I guess, what would you say is often the most misunderstood about your role or your specialty of podiatry?
I think just there's what our profession was intended to be is kind of fill that gap, from different specialties that, maybe a neurologist treats certain nerve things, but they maybe not focus on neuropathy in the feet because it's just difficult. I would even say, I don't want to go off on a tangent, but like warts. A dermatologist, and I even had a wart on my hand, and I used the basic treatment, and in 1 week it was gone. Foot warts can be really difficult to get rid of. And so a lot of specialties just don't really know. It could be the same type of wart, but it takes 3 months in the foot versus 1 week in the hand. So the foot is a fairly slow healer in general. It's just the farthest from the heart, has the most decrease in blood flow, as well as probably the most heavily used because it's a weight-bearing structure. So I think some of the misconception is maybe like, hey, a podiatrist maybe cuts toenails or does wound care, or hey, there's a difference. You got to go to a surgeon versus someone conservative. I think I have the one specialty in what I do that it really is like a one-stop kind of do everything. That it's like, hey, I know the most advanced treatments conservatively to work on, and the people like yourself where to go to get you recovered the quickest, versus like, hey, here's the surgery, and there's not a single surgery out there that is studied and backed that I don't do. So that I think that is the thing, is I do see people that are like, well, I went to this doctor and it's all for the foot, but it's like, well, I don't treat the skin, I just do the veins, and I don't treat the bones, I just do the joints, and I don't do surgery. So they almost keep the patient in longer than they may need to because they don't offer some of those other things. So I think,
Totally
like anything, it's educating as a patient on what that person may in fact do, because I do find that the patients that kind of start with me have a huge comfort level, because it's like, hey, I know you're intending on getting me better with the simplest things possible, but they know that they also don't have to like transfer their care over if all of a sudden it advances.
Come to know each other a little bit better the last couple of months, and have shared patients, and we've collaborated quite a bit. But more for the listeners here, as a physical therapist and podiatrist, I guess, how does your care complement physical therapy or other providers, and like in a more multidisciplinary approach or fashion?
Well, I mean, I truly think physical therapy is so vital. And I did a lot of sports medicine with a lot of pro teams and college teams and stuff. So I really saw that, when you look at the reason I even give it this example now of like a pro athlete is like, money is no object. It's just the outcomes. It's get this person better as fast as possible. So if someone uses, a newbie, hey, they might get over a shoulder problem, but it might take 3 or 4 months versus 2 or 3 weeks. So for an athlete, that's really vital to a team that they get them back on the field as quickly as possible. So I think it really goes hand in hand. I mean, I think that, I'm really good at diagnosing. I know a lot of biomechanics. I know how the foot moves. It's a really complex structure, but once you kind of
Yeah.
know it, I can give pretty pinpoint direction. And I think what I find excellent about yourself, especially, is you also are an excellent diagnostician. There are times that I'll see plantar fasciitis and I just don't even have the ability or time to say, hey, I'm going to fully assess your hip, your knees. But most of the
Correct.
time, it's a chain reaction. So tight
Yep.
glutes can lead to tight, hamstrings can lead to tight gastrocs,
Right.
which lead to
Right.
plantar fasciitis. And if all I'm doing is cortisone shot or custom orthotics and I'm not addressing the chain, then
Yep.
it's going to be short-lived relief. Whereas
Yeah.
someone like you that can really assess those kinds of things, I think, a physical therapist like yourself is not really like a pharmacist at times when you're like, send something to Walgreens and they're just making sure to fill. Like you have a lot of insight that is so valuable in saying, oh, hey, you have a shin splint, but do you realize, that your rectus femoris is just not firing? And again,
Yep.
those kinds of things, kind of finding those needle in a haystack for all populations of people
Yep.
are what
Yep.
really make the biggest difference. And so I always valued physical therapy.
Mhm.
Before it's kind of a compliment, like, okay, they had surgery and you can rehab them a bit quicker. But now
Sure.
I feel like it's vital to me because, like, you tend to find things that may have been years in the making that maybe led to this
True.
acute foot problem. And if you don't address those chronic things, it just will not go away.
Yeah. Yeah. Exactly like you said. And I think the more patients, the more we have conversations like this, the more we can kind of educate the general population on this. And I think more people are realizing that, exactly like you said, we might be able to help some things with the foot and symptomatically, but there is a chain to this. There's an upper chain, like you mentioned, the quad and the glutes that can play a huge role in what the foot's doing.
Yeah.
So it's just like a hand in glove relationship. What would you say to somebody that might be listening or listens to this? What can happen, I guess, if somebody waits too long? Let's kind of touch more a little bit on that. Like, what
Yeah.
happens if they wait too long to go see someone like you?
Well, for example, I had a guy that had an Achilles rupture. He didn't
Hmm.
really know it was an Achilles rupture because he just didn't know the anatomy that well. He kind of felt a pop in his leg and he kind of had some weakness and swelling. And,
Hmm.
even at that, like, say you even had the window of 2 weeks because it wasn't unbearable pain, but he just noticed a major change. Now, in a
Yeah.
situation like that, I'm always like, hey, come in, let's look at it. But even if he had waited 2 weeks, I think the recovery would have been infinitely different because it was a surgical intervention. But he waited more like 7 or 8 weeks. So by the time he came in, the repair was much more difficult, had to have a tendon transfer and a lot more involved with that surgery that added to a big recovery time. So even something
Mhm.
like surgery. Had it caught it within 2 weeks, like that would have still been kind of an acute process, but your body develops scar tissue, like especially like the more minor things like plantar fasciitis.
Yeah.
Your heel starts to hurt, so you walk on the side of your foot. So you can get
Right.
peroneal tendonitis, you can get posterior tibial tendonitis, you can get the calf muscle can get tighter because
Mhm.
you're walking not on the heel. And so now you get more forefoot pressure. And I get runners with plantar fasciitis that'll get stress fractures because of plantar fasciitis. So it seems to be a domino effect. And that,
Sure.
that concept of a domino effect where you take 1 2 inch domino that can knock over something twice its size, 29 times over, it can knock the Eiffel Tower down. That same concept is kind of, in the foot that you have one little compensation that manifests itself over a period of time. And now you have a lot more issues to address. And now you're starting to get maybe a quad that wasn't involved that now it's firing improperly. And you take something that might be a week or two recovery. Now you
Mhm.
turn it into a month or two.
I think that, like, we're seeing a lot of these things today. As the more we educate, the more people can kind of realize that some of these things that are manifesting could just be like a domino effect, like you said, that could just happen so long over time. And it goes going back to your previous point, it can take so long to kind of figure out or to fix it because you've been dealing with it for so long, because there's so many things that we have to address.
Well,
So
there was an analogy that I heard from someone that, like, for every month you have plantar fasciitis, it may be an extra week. So I've had some people that's like, oh, it's been this way for 2 years. Well, then you do the math on that. That is a long recovery because they've just that the tissue doesn't tend to have good blood flow in the foot. So then when it gets tried to repair itself, it doesn't repair properly. So it repairs with scar tissue and stiffening. And so then it really changes your gait and your muscle memory. And that next thing you know, it's like you're starting to get problems in other places. So I definitely think, early diagnosing is as important as anything.
Yeah, I agree. And I think it's important to have these discussions like we've been mentioning for patients, for expectations, like figuring out what their expectations are based on where they're at, and just knowing the longer something you're dealing with something before getting it checked out, the longer it's going to take to get to a point where you're feeling good and moving optimally. Right. What's one simple step that someone can take to prioritize their health even before they might call your office to make an appointment with you?
I mean, I would be careful with Google because it can take you down a dark path. Now, I think it's okay to do a little searching. I mean, take everything with a grain of salt. If it's heel pain and they seem like pretty benign treatments, stretching the calf is a huge one, getting better support on the foot. Those are obviously things that can, benefit. There's a lot of holistic medicine out there these days, from arnica, bromelain. So sometimes if you're just looking up, kind of holistic methods for inflammation, those are always safe things to try, that are pretty, benign in terms of side effects, things that, seem reasonable to do and things like that. But then again, I think there's just a fear in medicine that like, oh gosh, what's this going to cost? What's this going to entail? That there's really a fear there that, is part of the reason I started the practice to kind of alleviate some of that.
Yeah, absolutely. Yeah, I love that.
Well, same with you. It's like, upfront pricing, cash prices. I mean, I'll get some patients that'll call and maybe we don't take their insurance, but it's like you can get an ultrasound, x-ray, full analysis, office visit. And it's like, that's the price right on the website, right? So you at least go into it. If that's something that you can wrap your head around, it's like, hey, at least I'm going to leave here knowing a ton of information. And it's not something that you're going to get some mystery bill 2 months later, for $800, something crazy. It's just very upfront. I think that matters in general because, there is some value to medicine, and there is some value to good care, but you also need to know kind of what you're getting into before you even get into it.
Yeah, that's exactly right. We haven't really, I assume that would be your philosophy as well, because I'm the same way. At the very least, you come in, you know what you're going to get, and you're going to leave just knowing so much more information to at least to better make a decision or to better manage it, at least partly on your own. Right. So that's super important. Yeah.
Oh yeah. We give kind of post-op things, like post-visit things that like tells what they have, all the treatments, so that they can go home and without any pressure go, oh, hey, like that's a really good evidence-based therapy versus this. And you can kind of make your own educated decision, not on the spot, not just, oh, yep, you're getting a cortisone shot, sit down and hold on. But like, hey, this is the benefit versus risk of everything that you could choose. And if you're ready now, let's do it. If not, let us know what you think.
First time patients, what should they expect in that initial evaluation or that initial appointment with you?
But even if you check out the website, my wife, who is non-medical on purpose, she was an architect and a contractor, but she really, has struggled as a patient, just feeling like she was put through the conveyor belt of practices that, you get to see the doctor for seconds. So we really tried to kind of redesign that. So, the waiting room's real comfortable, couches and coffees and soft drinks and different drinks and things. And, the staff is just very warm and comfortable. And then generally you'll get some diagnostic testing if it seems like, it's a fracture or something indicated for an x-ray. I'll generally do the ultrasound on people. And usually, the turnaround to get into a room is very quick. And then I try and spend literally as much time as each person needs. So it's really not based on time. It's based on the need that a patient has, what they have going on, and just, methodically working through what they have and options there. And so I think it's, it's a very comfortable environment. Our slogan is come home to heal. And the way I looked at it is, if you have surgery, you have an injury, where are you going to want to be? You want to be at home. So we tried to make that as close to a doctor's office as possible, just because, we want to breed like a comfort in people that they feel like we're giving them, honest advice, but also allowing them to, again, make their own decisions.
Dr. Barnett, what's the best way for somebody to get in touch with your office to book a visit? By the way, where you're located in South Pasadena, I just want to let everybody know that's listening.
Kind of by the hospital, Palms of Pasadena, just right off the causeway, on the Pasadena side. A lot of ways. We have an Instagram, which is Align Foot and Ankle. Our website is alignfootandAnkleAllWrittenOut.com. We've got a Google page that you can find us. Generally, you're going to get one of three people every time. It's me, Jenna, or Angela. So, when you call it, you're going to get similar people every time you call. And again, it's my staff is really good at kind of talking through. And even if someone is not sure if an appointment is necessary, we can even kind of talk through some of that beforehand just to see if it's, something that makes people comfortable.
Yeah. So let's go on that. So what are any final thoughts, for somebody that silently struggling, if you will, with whatever it is? It could be plantar fasciitis. It can be a wart on the foot. Who isn't sure where to start? What would you suggest?
I mean, I think it's, some simple things like, do you really have to have a deep relationship with the doctor to do a treatment on a wart? Not necessarily, but I think part of that relationship is, I really pride myself and I do a ton of reading, looking at medical literature. I have colleagues at all the major institutions that are even conducting a lot of the research, as well as one of my, best friend's wives is a functional medicine doctor. So I consult with her once a week to learn everything. If someone's got gout, you can do true cherry extract and maybe get off of allopurinol. I mean, there's all these things that I always want to give people options. So I think, in the gist of it, I do think, at minimum, you're going to learn what's wrong and you're going to be extremely educated on, risks and benefits. And so I think that's where there's so much hesitation to that. And there's just not, I know you're the same. It's not high pressure. It's like, hey, let me just assess what you have going on. And then let's just talk and say, hey, it will be no pressure for any one treatment. Sure, I'm going to give my kind of medical advice based on putting myself in the patient's position. But at the same time, the decision is theirs and will always be theirs.
Dr. Barnett, thank you so much for joining the Professional Spotlight series. It really means a lot to have you come and share your story and what you do, and for all the people that you help. So really appreciate you.
I think you're doing an amazing job. And I think more medicine is going to this route because I think people need that one-on-one care that is just lost in medicine. And it's, it doesn't have to be that way. And I think it's just you as a patient, you kind of got to advocate for yourself, and you sometimes have to seek that type of care out because it is out there, and you exemplify that as well.
Awesome. Thank you. Really appreciate it.
Thank you, man.